All right, so I don't have a stethoscope to measure blood pressure, so I'm just going to talk through the procedure of how I would measure someone's blood pressure. I prepare the client just by having them at rest, so, resting, relaxing for about 5 minutes before we carry out the procedure. Client sitting down, sitting upright. Upper arm is positioned so that it is level with their heart, so I'd find something that will keep them level at their heart. Feet need to be flat on the floor. We take off any excess clothing that might restrict putting on the cuff, anything tight or anything like that. So, that might constrict blood flow. So just kind of remove any tight clothing or anything like that. So locating the brachial artery along here, I would place the blood pressure cuff nice and snug around this area with the marker points, the artery marker points pointing to that artery there. Near the crease of my elbow, and just nice and snug around the arm. So placing the bell of the stethoscope over the artery where I would hear the strongest pulse, so I would have a little feel around and then just feel where I could hear the strongest pulse. I would place the bell of the stethoscope there. Inflate the blood pressure cuff then to about 160 to 180 millimeters of mercury. And then slowly deflating the cuff down at about 2 to 3 mils per second. I then listen for the systolic reading, and my client's reading would be normal, and normal is usually around 120 over 180. So that's how I would measure blood pressure.